Hypersensitivity reactions refer to an inappropriate immune response, which is an overreaction of the immune system to an antigen or allergen. The Gell-Coombs classification of hypersensitivity is the most widely used and distinguishes 4 types of hypersensitivity reactions. Type 1 hypersensitivity, also called the immediate hypersensitivity, is associated with increased levels of IgE antibodies and eosinophils. Appears to atopic individuals. Atopy refers to a genetic predisposition to develop an allergic reaction, so an exaggerated IgE response to a harmless allergen. The reaction evolves in 3 stages. Sensitization stage, when a person comes into contact with an allergen for the first time. B lymphocytes transform into plasmocytes that start producing IgE antibodies specific to an allergen. Allergen-specific IgE antibodies attach to the surface of mast cells and basophils, becoming sensitized to the allergen. Activation stage, when a person comes into contact with an allergen for the second time. Mast cells and basophils are activated when the allergen binds to the antibodies on their surface, resulting in rapid release of histamine and other inflammatory substances called mediators, which leads to local or systemic symptoms of allergy. The effector stage, characterized by inflammation and allergy symptoms, and has 2 presentations. The immediate reaction that starts within 5 to 30 minutes and subsides in 60 minutes, and late phase reaction that starts in 2 to 8 hours and lasts 2 to 3 days. Local allergic responses include rhinitis, asthma, dermatitis, whereas systemic allergic response include anaphylaxis, which is a life-threatening condition. Type 2 hypersensitivity, which is the antibody-mediated hypersensitivity or cytotoxic hypersensitivity. IgG or IgM antibodies bind to an antigen on the surface of a cell and cause complement system and other immune cells to destroy it. Clinical examples include the destruction of transfused red blood cells when administered to a mismatched recipient, erythroblastosis fetalis, Graves' disease. Type 3 hypersensitivity is caused by circulating immune complexes, which are antigen-antibody aggregates. The classes of antibodies involved are IgG and IgM, and the antigen to which the antibody binds is not attached to a cell. The antigen-antibody complexes are deposited in various tissues and organs like kidneys, joints and blood vessels, causing an inflammatory response and tissue damage. Clinical examples include serum sickness and some autoimmune diseases such as systemic lupus erythematosus and rheumatoid arthritis. Type 4 hypersensitivity, also called delayed type hypersensitivity, is a cell-mediated reaction that involves the interaction of T cells, monocytes and macrophages and occurs in response to contact with certain allergens. Some clinical examples are contact dermatitis, chronic transplantation rejection, tuberculosis, and leprosy.